The prostate is a small gland, about the size of a walnut, located below the bladder and in front of the rectum in men. Don't let its size fool you. This gland plays a crucial role in the male reproductive system. The prostate's primary function is to produce a fluid that nourishes and protects sperm. This fluid, milky white in color, combines with sperm from the testicles to form semen. During ejaculation, the prostate contracts, propelling the semen through the urethra and out of the penis. This process is essential for reproduction. Beyond its reproductive function, the prostate also plays a role in urinary health. Its location near the bladder neck and urethra means that changes in the prostate can directly impact urination. Therefore, maintaining a healthy prostate is vital for both reproductive and urinary health in men. As men age, the prostate undergoes natural changes. One of the most significant changes is its tendency to grow. During puberty, the prostate doubles in size. It continues to grow gradually throughout adulthood. By the time a man reaches his 40s, the prostate may have grown slightly larger. This growth becomes more pronounced with advancing age, and by age 60, the prostate can be the size of a lemon. This enlargement is primarily due to a process called benign prostatic hyperplasia, or BPH, which we'll discuss in detail later. These age-related changes in the prostate are influenced by hormonal fluctuations, particularly the role of dihydrotestosterone, or DHT, a male hormone. DHT can stimulate prostate cell growth. As men age, the balance of hormones in their bodies shifts, and this can contribute to prostate enlargement. Benign prostatic hyperplasia, or BPH, as mentioned earlier, is a non-cancerous enlargement of the prostate gland. This condition is quite common and tends to develop as men get older. It is a prevalent condition affecting millions of men worldwide, particularly as they age. Studies show that by the age of 60, about half of men will have some signs of BPH, and by age 85, the number rises to 90%. BPH is not a life-threatening condition, but can significantly impact a man's quality of life due to its effect on urinary function. The symptoms can be bothersome and affect daily activities. The enlarged prostate can press on the urethra, the tube that carries urine from the bladder out of the body. This pressure can obstruct the flow of urine. This pressure can lead to various urinary symptoms, including a frequent urge to urinate, especially at night. This condition, known as nocturia, can disrupt sleep and lead to fatigue. Men with BPH may also experience a weak or interrupted urine stream, which can be frustrating and time-consuming. Difficulty starting and stopping urination, which can cause anxiety and discomfort, and a feeling of incomplete bladder emptying. This sensation can lead to repeated trips to the bathroom. The severity of BPH symptoms can vary from person to person. Some men may have minimal symptoms, while others may find their symptoms severely impact their quality of life. Some men may only experience mild discomfort, which can be managed with lifestyle changes and medication, while others may have severe urinary problems that interfere with their daily lives, requiring more intensive treatment. If left untreated, BPH can lead to complications such as urinary tract infections, bladder stones, and kidney problems. Therefore, it is important to seek medical advice if you experience any symptoms. Prostatitis, another common prostate problem, refers to inflammation of the prostate gland. This condition can be quite painful and disruptive to daily life, affecting a man's ability to urinate comfortably and even causing significant discomfort in the pelvic area. Unlike BPH, prostatitis is not age-dependent and can affect men of all ages. This means that young men, middle-aged men, and older men can all experience the symptoms of prostatitis, making it a widespread issue. There are different types of prostatitis, each with its own set of causes and symptoms. Understanding these types is crucial for proper diagnosis and treatment, as each type requires a different approach. Acute bacterial prostatitis, as the name suggests, is caused by a bacterial infection of the prostate. This type of prostatitis is often severe and requires prompt medical attention to prevent complications. It typically comes on suddenly and is characterized by symptoms such as fever, chills, pain in the lower back and genital area, painful urination, and a frequent urge to urinate. These symptoms can be quite alarming and often lead to an urgent visit to the doctor. Chronic bacterial prostatitis is a long-term infection of the prostate that can be challenging to treat. This condition often requires extended courses of antibiotics and can be frustrating for patients due to its persistent nature. Men with chronic bacterial prostatitis may experience recurrent urinary tract infections, pain in the pelvis and genitals, and pain during ejaculation. These recurring symptoms can significantly impact a man's quality of life and require ongoing management. Chronic prostatitis, also known as chronic pelvic pain syndrome, is a type of prostatitis that is not caused by a bacterial infection. This form of prostatitis is particularly complex and can be difficult to diagnose and treat effectively. The exact cause of chronic prostatitis is unknown, but it is thought to be related to factors such as inflammation, muscle tension, and psychological stress. Managing this condition often involves a multidisciplinary approach including medication, physical therapy, and stress management techniques to help alleviate symptoms. Prostate cancer is a serious health concern for men, ranking among the most common types of cancer diagnosed in men worldwide. It affects millions of men each year, and the numbers are steadily rising. It occurs when cells in the prostate gland grow uncontrollably, forming a tumor. This uncontrolled growth can lead to a variety of health complications if not detected and treated early. While prostate cancer can be aggressive, many men diagnosed with this disease have slow-growing tumors that may not cause significant health problems in their lifetime. These slow-growing tumors often allow for a range of treatment options and a better quality of life. The causes of prostate cancer are not fully understood, but several risk factors have been identified. Research is ongoing to better understand these factors and how they contribute to the development of the disease. Age is a significant risk factor, with the risk of developing prostate cancer increasing after age 50. The likelihood of being diagnosed with prostate cancer rises sharply as men grow older. Family history also plays a role. Men with a father or brother who has had prostate cancer are at a higher risk. This genetic predisposition makes it crucial for men with a family history to undergo regular screenings. Other risk factors include race and ethnicity. African American men have a higher risk, certain genetic mutations, and lifestyle factors such as diet and obesity. Maintaining a healthy lifestyle can help mitigate some of these risks. Prostate cancer often does not cause noticeable symptoms in its early stages. This makes regular screenings and checkups essential for early detection. As the tumor grows, it can cause symptoms similar to BPH, such as difficulty urinating and frequent urination. These symptoms can significantly impact a man's quality of life and should not be ignored. Maintaining a healthy prostate involves making informed lifestyle choices. A balanced diet rich in fruits, vegetables, and whole grains can promote prostate health. Regular physical activity is also crucial, as it helps maintain a healthy weight and reduces the risk of developing prostate issues. Avoiding smoking and limiting alcohol consumption are additional steps that can support prostate health. It's also important to stay hydrated and manage stress levels, as chronic stress can impact overall health, including the prostate. Regular checkups and screenings with a healthcare provider can help detect any potential issues early, allowing for timely intervention and better outcomes. When it comes to treating prostate issues, there are several options available depending on the specific condition and its severity. For benign prostatic hyperplasia, or BPH, treatment may include medications to relax the prostate muscles or shrink the gland. In more severe cases, surgical procedures may be necessary to remove excess prostate tissue. For prostate cancer, treatment options vary based on the stage and aggressiveness of the tumor. These can range from active surveillance for slow-growing cancers to surgery, radiation therapy, and hormone therapy for more advanced cases. It's essential to discuss all available options with a healthcare provider to determine the best course of action based on individual circumstances and preferences. Taking charge of your prostate health is a lifelong journey that involves staying informed, making healthy lifestyle choices, and seeking regular medical advice. By understanding the risks and taking proactive steps, you can significantly reduce the likelihood of developing serious prostate issues. Remember, early detection is key, so don't hesitate to talk to your healthcare provider about any concerns or symptoms you may experience. Your prostate health is an important part of your overall well-being, and taking care of it can lead to a healthier, more fulfilling life.